This section of the video shows you how to check the young infant for feeding problem and malnutrition, including how to assess a breastfeed.
First, ask the mother.
Is there any difficulty feeding?
Ask.
Is the infant breastfed?
Breastfeeding the baby?
If the mother answers yes, ask.
How many times in 24 hours?
Next ask.
Does the infant usually receive any other foods or drinks?
If the mother answers yes, ask.
How often?
Then ask.
Does she receive any other?
What do you use to feed the infant?
You need to assess breastfeeding if the young infant has any difficulty feeding, is breastfeeding less than 8 times in 24 hours, is taking any other foods or drinks, or is low weight for age, and has no indications to refer urgently to hospital. Assess breastfeeding in the following way.
Ask, do you have pain while breastfeeding? If the mother says yes, look for sore nipples and breast engorgement or breast abscess.
Ask.
Has the infant breastfed in the previous hour?
If the young infant has been fed and is not interested in feeding, ask the mother to wait and tell you when the young infant is ready to feed again. If the infant has not fed in the previous hour, ask her to put him to the breast. Observe the breastfeed for 4 minutes. Is the infant able to attach? Look for the 4 signs of good attachment. Good attachment is essential for the young infant to feed well.
The 4 signs of good attachment are the chin touching the breast, the mouth wide open, the lower lip turned outward, more areola visible above than below the mouth, this young infant is well attached with the chin touching the mother's breast. This young infant is attempting to feed with its chin not touching the breast. There is an obvious gap between the young infant's chin and the mother's breast. This child is not well attached. When the young infant is well attached, the mouth is wide open. This young infant is feeding with its mouth wide open. This young infant is feeding with its mouth partially closed. It is not well attached to the mother's breast and is therefore having difficulty feeding. When the young infant is well attached, the lower lip is turned outward. With this young infant, you can clearly see the lower lip turned outward while he is feeding. With this young infant, the lower lip is turned inwards. It is not well attached. When the young infant is well attached, more areola is visible above than below the young infant's mouth. With this young infant, you can clearly see more areola above than below the mouth. If there is the same amount of areola above and below the young infant's mouth, as in this child, or if there is more areola visible below than above the child's mouth, the young infant is not well attached. When a young infant is well attached, as in this case, he shows all 4 signs of good attachment.
Then look to see, Is the infant suckling effectively?
When a young infant is suckling effectively, he takes slow, deep sucks. Sometimes he pauses and then starts suckling again. You may be able to see him swallow. This young infant is suckling effectively. This young infant is not suckling effectively. The young infant is making mostly rapid sucks. You cannot see swallowing. A young infant who has had a good breastfeed will stop suckling and release the breast spontaneously. He has had enough and is satisfied. He has lost interest in the breast and he appears relaxed and sleepy. This young infant demonstrates the signs of good attachment. The chin is touching the breast. The mouth is wide open. More areola is showing above than below the young infant's mouth. However, you cannot see the lower lip. This is because she is very close to the breast, making it very difficult to see her mouth at all. This sometimes happens with babies who are very close to the breast. We asked the mother to hold back her breast so that we could see what was happening with the lower lip. You can see that the lip is turned outwards. If a baby is very close to the breast and shows the other signs of good attachment, the young infant is probably well attached. You do not need to hold back the mother's breast to check the lip. You can see that this young infant is giving slow, deep sucks, sometimes pausing and swallowing. The young infant is suckling effectively.
Look for ulcers or white patches in the mouth. Ulcers or thrush can make it difficult for the infant to suckle.
If an infant does not suckle effectively, the breast milk does not flow well, and the infant gets it slowly. He may want to suckle very often, or for a long time, or he may gain weight too slowly. If an infant is poorly attached or not suckling effectively, you should help his mother to position and attach him better.
If a mother positions her infant well at the breast, it helps the infant to attach well and to breastfeed effectively. In a well-positioned child, the neck is straight or bent slightly back. The infant's body is turned towards the mother. The infant's body is close to the mother. The infant's whole body is supported. This infant is well positioned. His neck is straight. He is turned towards his mother. His body is close to his mother's. And his whole body is supported. The following are signs that an infant is poorly positioned and that it may be difficult for him to attach well and breastfeed effectively. If the infant's neck is twisted or bent forward. If the infant's body is turned away from his mother. If the infant's body is not close to his mother. If only the infant's head and neck are supported. If any of these signs are present, the infant's position may need to be improved. This infant is poorly positioned. His neck is twisted. The child is on his back, with his body turned away from his mother. The infant's body is not close to the mother. She is not supporting his whole body. This infant is poorly positioned. The infant's body is not close to his mother and is not well supported. You will now learn the steps to help a mother to position and attach her baby correctly. First, make sure that the mother is in a comfortable position and that she's relaxed. If she's sitting, she should be on a low seat and her back should be straight. If she's lying down, she should be on her side in a position in which she could sleep comfortably. She should hold her infant with his head and body straight and facing her breast. With his nose opposite her nipple. She should hold the infant close to her body, and she should support his whole body, not just his head and neck. When the young infant is in a good position, show the mother how to help him attach to the breast. She should touch her infant's lips with her nipple. Wait until the infant's mouth is opening wide, then move her infant quickly onto her breast, aiming the infant's lower lip well below her nipple. Let's watch that again. The mother touches her infant's lips with her nipple, waits until the infant's mouth is opening wide, then moves her infant quickly onto her breast, aiming the infant's lower lip well below her nipple. Look for signs of good attachment and effective suckling. You can see that this infant is well attached and suckling effectively. If the attachment or suckling is not good, take the baby off the breast and try again. It may be necessary to try several times, and for the mother to practice at several feeds to get her baby to attach well every time. Explain to the mother what to do, so that she can practice attaching the baby correctly when she's at home. Explain to the mother that if her baby is well attached, she should let him feed as often as he wants. Breastfeeding 8 or more times a day helps to ensure a good supply of milk. Explain that at each feed, she should let her baby breastfeed for as long as he wants. She should not stop the breastfeed before her baby is ready. Let him release the breast by himself. Ask to see the mother and baby again in 2 days.